So why did mental health services need to be changed? The existing contracts were coming to an end, and we thought that it was a really good opportunity to make some of the changes that we knew that were needed.
And we had started to look in terms of what was best practice around, and we knew we had some work to do to really get the model for Bedfordshire up to quality services that we'd really like to see locally.
So for the last 12 months we've been working with parents and carers and those children and young people who use the current CAMHS service to understand what makes a good service and what's important for them. Then we've been talking to the local authorities about their experiences of the current services that we deliver in Bedfordshire and how these can be improved to make sure that we have CAMHS services that are the best they can be.
My experience of the mental health service has been very hit and miss, and I've had some really good help and some people that haven't helped me so much. And so when you have a really good standard of care, it helps you so much.
We heard lots of things from people who are accessing services that were important to them. Some of the key messages were that they wanted to be able to access services quickly, and they wanted that pathway to be very easy when they needed to access services. They didn't want to have to continue to tell their stories again and again and again. Once they'd said it, they wanted that to be heard, and they wanted more support in their journey of recovery to keep them well.
I think the reason mental health services need changing is that we need a far more joined-up approach than there's been in the past. Early intervention being particularly important, and continuity of care, so that there is a person or an organisation that is there for the medium and long term. Generally speaking, mental health issues are not short-term by nature, they're long-term by nature, and they need a long-term solution to them.
We started a procurement process. We started that in April this year, and that's been quite a long and comprehensive process, and as part of that we've had a very independent stakeholder panel made up of service users and carers and representatives from Healthwatch, and they have worked really hard in developing some questions around things that really matter to them in services, and they've interviewed all the bidders as part of that and scored them and contributed to who's going to make a difference for services in Bedfordshire.
Because coming from someone that uses the service, I really appreciate the opportunity to be able to get across sort of how I've used the service and how hopefully it can help to make it a better service by sort of giving my experiences.
The reasons that I wanted to get involved in the stakeholder panel is that I'm passionate about mental health. I was very fortunate in that I had a very supportive family, an outstanding GP and access to other services. Whereas I know of others that were not so fortunate, and therefore top quality mental health provision in the community is an absolute priority.
We had a wonderful training session a few weeks before the actual interviews took place. And to start off with, we were in our groups that we were going to be in later, and we discovered how all of us had different opinions about everything, but they were all right in their own way.
I'd like to say thank you because I really appreciate the opportunity to be able to get involved and help, because it means a lot to me to try and make things better for other people.